Channel 5 Network. This is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. I'm Nick Barris. Have you kept track of what day today is? It's always hard coming off a holiday weekend. I get mixed up. It feels like Tuesday, but today is Wednesday, and it's good to have you with us. We're going to have a chance for you to call in this morning. It's Ask a Medical Expert this morning. We're going to talk about your dental care, taking care of your teeth. I've got all kinds of questions about that because I tell you, my teeth are falling out. Well, not literally, but I do everything I can to care for them. And I guess as you age in general, especially if you had habits like crunching ice or eating popcorn kernels, you pay the price later. What was I thinking? All right, we're going to get into that and more. And the number's on the screen, 737-7587. If you have questions on a broad range of topics for our guest, the dentist, Dr. Brandon Sims. Good morning to you, sir.
Good morning.
Nice to have you on. Stupid chewing popcorn kernels. But it's at the bottom of the box. You're done with the popped stuff at the movie theater. It's tense. Instead of biting my fingernails, I pop those in. Crack a tooth waiting to happen.
Yeah.
Waiting to happen. What else is bad to chew on? Ice, bad idea?
Yeah, well, I mean, anything that's not nutritional is probably not good to chew
and
on.
hard.
Exactly.
And crunching it on it and all of a sudden crack something. I've had more than my share. I'm wondering, I've had friends growing up who would eat all this candy and, not do the proper dental care. And yeah, their teeth maybe weren't as clean as they should be, but they never got cavities.
That's right.
And there's other people out there that may do everything. Floss, clean, fluoride, go to the dentist every 4 months, and still get cavities. Are some people's teeth just stronger than others?
I'm not sure that stronger is the right word, but we all have a genetic component to how we're made.
Okay.
And that includes not only the composition of our teeth, but also what kind of bacteria we have in our mouth. So some people have maybe teeth that are more easily fractured or more easily broken down by the bacteria. And maybe some people have more aggressive bacteria that cause more cavities or more gum disease.
And again, bacteria is what causes the cavities. We talk about you find a cavity. You say someone who doesn't brush their teeth, or you eat lots of sweets. Why is it that sweets or sugars are more prone maybe to cause cavities than, say, milk?
Well, actually, milk, if you drink it at the wrong times of the day, can cause a lot of cavities as well.
Really?
Oh, yeah.
What do you mean wrong times of the day?
So anything with sugar in it, milk actually has a lot of sugar in it. So when I talk to patients, it's sports drink, soda. Of course, everybody knows soda, but milk or fruit juice, sweet tea, coffee, even just with creamer if you don't put sugar in it. Those kind of things, if you sip on it throughout the day, will cause a lot of cavities.
Now, coffee, but I'm sipping some right now, can stain your teeth with time to some degree.
Black coffee and plain tea don't have the same cavity-causing ingredients that you put creamer in it or you put sugar in it. It certainly will. Yeah, but even some people, even black coffee will cause their teeth to break down.
Okay,
if they're really susceptible to it.
Yeah, and if they drink a lot of it. Is there anything worse for your teeth than those people who every time you see them, they've got either a bottle or a cup under their arm, and they're sipping sugar soda pop all day long? I'm telling you, okay, I can't imagine there being anything worse than that. Well, maybe chewing sugary gum all day.
Anything with sugar in it, but it's surprising that
carbonation. I don't know. Does that?
Well, sodas are very acidic, but fruit juice is just as acidic sometimes.
Okay.
And sports drinks are just as acidic.
Like lemonade Gatorade, or something, or some of those.
Gatorade, Powerade. Those things are also very acidic. So I mean, soda pop's bad. I'm not saying it's good for you, but there are other things as well that we don't always think about. Everybody knows sodas are bad for your teeth, but not everybody understands that if I'm drinking Gatorade all day long, I'm going to have the same issues.
Are the artificial sweeteners, can they be damaging to the teeth as well? I'm just curious.
Not necessarily. But those drinks are probably still acidic. So drinks that taste good are probably still really acidic, and they can cause attrition or acid wear to your teeth.
Okay, so the acid is part of it. Well, that's interesting. Listen, I wanted to ask you just a little bit about what you're seeing in the clinic these days. We're going to hit on several different points, and we can take your phone calls if you have issues about your teeth. Heck, I went to the dentist yesterday and have a cracked wisdom tooth. But I mean, for you, what typically do you see now at the practice? When you sat down today, it's pretty business as usual. What are the big things right now?
In our practice, I think the new thing that we've been doing the last year is sedation.
Sedation. Mm-hmm. Now that's not new per se. Like, you're saying you're doing it more, or it's easier to do than ever before?
Well, I think both. I think the access to a sedation dentist is increasing. and we're certainly doing more of it. We've been licensed for over a year now, and just seeing a lot of demand for it.
Now, sedation, this means you're knocking someone out, right?
Not necessarily. So most general dentists will have what we call a moderate sedation license. So sometimes you hear it called twilight sedation or conscious sedation sometimes as well. So our patients are able to respond to commands, and they're able to maintain their own breathing habits, and they don't really care what we're doing, and when we're done, they don't always remember.
Now, I would guess
they don't remember what we've done.
And first of all, is this then something that's typically an IV?
That's what I do, is mainly IV sedation.
Okay. And usually this would be, except for some very extreme procedures that everyone would need, could be folks that are maybe a little unsettled about going to the dentist, or they're feeling some anxiety and this puts them at ease.
Honestly, we do the whole spectrum. So I have patients that are deathly afraid of just getting the IV, and getting them through that process is tough. And then, once we get them sedated, we're able to do some dental work for them. I have patients that just don't want to remember. They don't want to be.
Stalk me out.
Yeah, exactly. Just relax me. So it's really the whole spectrum. And the tough cases are the ones that are people who are really scared.
Where you may even sedate someone for a cleaning.
Exactly, yeah. Or people who have terrible gag reflexes. Sometimes we'll sedate people for X-rays. And do an X-ray and exam while they're sedated, and then have them back to talk to them about what we found. So there's a whole spectrum.
I think that's a great option. Now, when I've been before, on occasion, when they're doing, say, a root canal or something, I've never had full sedation, because I can tolerate it, and it doesn't bother me as much as some people. Mm-hmm. But I'll get the local, all right, which is the Novocaine or something, the shots in the mouth, and then they'll give me the nitrous oxide mix, which kind of, it doesn't knock you out. It makes you a little lightheaded. I guess in some degree it relaxes you. Is that what that does?
It depends on who you are again. But some people it really relaxes them, and other people say they don't feel it.
Yeah, I feel it subtly. It maybe relaxes a bit, and it's a mixture of oxygen and nitrous oxide.
That's right.
And then when they wrap it up, they take it off, and you're breathing freely. And if your head's been a little foggy, it clears up right there on the spot.
Yeah.
So is that one step you would try with someone if they didn't think they needed the full sedation?
Well, and we use that a lot for people who just want a mild, something to relax them. Yeah. Either maybe get them through the injections or through the whole procedure, but don't want to have someone bring them to the office.
Yeah.
Because when you're having medicines either placed under your tongue or placed in an IV, you really need someone to drive you there.
To drive you there and home.
And take care of you afterwards, for sure.
Makes sense. All right, listen, before we take our first break, let's squeeze in a quick phone call. Donnie, good morning.
Good morning.
Hey, Donnie, how can we help you?
Yeah, I just wanted to know how much does it cost to take all your teeth out and be sedated? That's what was my question.
How you take all your teeth out and what? And be sedated?
Yeah. How much does that cost?
Are you going to have all your teeth removed?
I want to.
Why?
I pull my own teeth and I'm getting tired of it.
Okay, hold on a second now. You got to fill me in here, Donnie. Is this something that where you had cavities, rotten teeth, and you didn't have the insurance to do it, so you just pulled them out yourself?
Right.
I'm so sorry you went through that. So you still have some cavities, and you want to get your teeth taken care of and just replace them with dentures?
Yeah.
How old are you?
I'm 56, almost 57.
Fair enough. Okay. Wow. And I was just talking about this with a friend the other. And Donnie, listen in. We'll see if we can give you some advice on that. My heart goes out to someone like Donnie or anyone else who has a situation where you have an achy tooth or several like he does, and for whatever reason you don't have the means to get the proper dental care. Back pain and dental pain, the chronicness of it affects everything in your life. And I'm not just talking about just walking around feeling pain. I think it makes you depressed. It's rough. It's rough.
Is tough.
And this was so bad, this poor guy has been removing his own teeth.
Yeah, it's something I hear, quite often.
God, it's just not right in this country. We're the richest, most powerful country in the world, and there are people out there that can't afford a dentist and have to remove their own teeth. It's just wrong.
Well, I would agree, and I think that also too, we just have a lot of folks in America who are just do-it-yourselfers, and they just think, what,
maybe
I can handle it. I'm going to take care of it.
Yeah.
But I would say to your question, which is how much does it cost? It's so variable. My best advice to you is find someone, a family member or a friend that has had teeth removed or that has had dentures and has had a good experience, and go to their dentist and get a good a good estimate on that.
You know what I find, talking to most of the dentists over the years, and I've lived all over the country, the prime directive, if you will, seems to be do everything you can to preserve what's in your mouth. You know, sometimes I'll say, what? There's a big cavity in there, why not just yank it out? I go, no, we fill that and your tooth is still healthy, and you do everything you can to keep your teeth in your mouth. So under what circumstance would you have an individual that you decide, just based on the condition of their teeth, yes, it's probably best for you to remove them because you just are going to continually have problems with them?
I think that's really up to the patient.
So but is it just constant pain? Because like sometimes I'm like, why not just yank it? And they go, no, Nick, we fill it. It's still a good tooth. Don't do that.
Well, the most predictable and best functioning, if you want to call it an appliance, but setup that you can have to look good, to eat good, and to feel great is your own natural teeth.
Makes sense.
That's the best we've got. There's still no great fixes that are as affordable as saving your own teeth. And we have implants nowadays, and I have people that say, well, I'll just take out my teeth and do implants. And yes, it's an option. It's expensive, and there's also risks to it.
Yeah.
So if we can do a root canal and save your tooth, it's always better for you.
Yeah.
So now people who have, if like you're talking about earlier, folks who maybe had a soda habit for years, and the decay, the problem with soda is that you get cavities on all your teeth. So maybe the cavities are so extensive and there's so much pain that reliably fixing that many teeth is out of someone's budget.
Yeah.
Then we talk about removing teeth and maybe placing a denture, or coming back with implants to support that denture later if we need to.
Yeah, so maybe Donnie has an extreme case, but you need to get an estimate because he says it varies
and it's
from person to person.
Dentistry is a science, but it's also a lot of artwork.
No kidding. Yeah.
So we don't know. In Donnie's case, we don't know how many teeth there are to take out, or if they need to be taken out. Does it need a full denture or a partial denture? There's so many moving parts. For me to give a cost estimate, I would just be shooting in the dark. So it's important to get your own situation assessed. That way you can get an accurate idea. So I'm not, giving you something too low or too high.
Several $100s or into the thousands of dollars to do that, aren't we? I mean, just ballpark.
To go get it checked out is probably a couple hundred.
Yeah, and then but then to actually have if they decide he still has several teeth in there, I mean that's not going to be cheap to remove everything in your mouth and then to get dentures.
It's not. Yeah.
Okay. Listen, on that note, we need to take a break. When we come back, take more of your phone calls. Charlie and others, if you're on hold, stay there. We'll get to you. The number 737-7587. It's Dr. Brandon Sims. He's a dentist. And if you have any questions about your oral care, dental care, teeth, and all of that, we'll get into more details with him right after this. Stay with us.